Two cardiosurgeons are working at the surgical table, a Ukrainian and an Italian. Paolo Ferrazzi has developed a unique way to treat hypertrophic cardiomyopathy, a condition in which a portion of the heart becomes thickened without an obvious cause. This surgery is called the Ferrazzi method, as he was the first doctor to implement this specific surgical technique. Ukrainian cardiosurgeon Konstantin Rudenko gained his experience with this surgery in Italy.
Our experience is 165 surgeries. We perform surgeries on patients starting with infants. Meaning last week we performed a surgery on an 8-month-old toddler and then on a 90-year-old.
Now I think Ukraine, this center is the second center in Europe, in all of Europe. Because let me say now, this is doing around 75 per year, so London, that is huge centers with the malaria cover, just 25 a year.
This international surgical crew is operating on a 32-year-old man. His condition runs in the family, and the surgery was already scheduled. But Volodymyr was caught by surprise with a sudden cardiac arrest. He barely survived.
I had no diagnosis and never had any complaints about my heart. I fell ill in Germany and became unconscious. Some woman was doing CPR before the ambulance came. They took me to a clinic in Hamburg. Then back here in Ukraine, I got my surgery done very quickly.
According to estimates from the World Health Organization, around 70,000 people have undiagnosed hypertrophic cardiomyopathy. 10% of the people with this condition face sudden death every year. It's very important to diagnose this condition early. For that reason, Paolo Ferrazzi gave a lecture at the Amosov Institute and then performed a masterclass for surgeons.
In order for the doctors and especially cardiologists of the first and second tier to be oriented to look for this condition, we need these master classes. Not only for cardiosurgeons, but also for cardiologists.
Ukraine currently has 3 cardiology centers where doctors perform surgeries according to the Ferrazzi method. Reported by Inessa Zanina, UATV.